So what's the proportion of people actually suffering allergic rhinitis versus just an allergy?
Look, so a lot of people have allergic rhinitis. It's really common in the community. So if you said to me in Australia, about 20 to 30% of Australians will have some form of minor allergy. Very few of those actually treat it though regularly. There are a group of patients who acknowledge that they have terrible hay fever or allergic rhinitis and take a lot of treatment for it, and maybe even go down the path of disease-modifying interventions like immunotherapy. But probably the broader group are these group of patients that have very minor symptoms. But it's there and they need to have ways of managing it. And this is where I think over-the-counter treatments, antihistamines, intranasal corticosteroid sprays, which have shifted from the prescription zone into something that's easily available now, really need to be utilised in the right way.
Just on that note, the overuse of antihistamines, at what point should a pharmacist step in? Is that a problem?
Yeah, look, I don't think antihistamines should be used regularly. If they are, then a discussion really needs to be made for intranasal corticosteroids, because they're a far more effective treatment. There's actually many randomised trials comparing head-to-head of antihistamines versus intranasal corticosteroids. So I think the shift should be discussed then, but I think antihistamines certainly can be used intermittently, they can be used in combination with. I don't think there's really any significant concerns apart from the sedation phenomenon with using long-term antihistamines.
How many's too many in terms of using antihistamines? If a patient presents using a number at the same time?
I think there's probably room for rationalisation.
Yeah.
So the market's full of a lot of different types of antihistamines, but if you look at them, they only fall into about 5 or 6 broad groups. So I think looking at what they're actually taking, making sure it's a second generation is probably the most important thing. And once again, talking about the idea that if they're taking antihistamines in isolation, that's the time to introduce them to things like corticosteroids, which are now available over the counter.